It's been almost 3 years since my last video on microneedling. In that time, it's arguably gotten more popular than ever before. It's available as an in-office treatment or as tools sold for at-home use. Fans of it say that it regrows hair, rejuvenates the skin, and gets rid of scars and pigmentation. But are these almost too good to be true claims minimizing the risks? If you're not microneedling, are you missing out on revolutionary skin and hair treatments? And for those who microneedle regularly, are there downsides to be aware of? What do you need to know about the evolving science around microneedling in 2024? And at the end, I'll give you some of my thoughts on microneedling DIY culture. Microneedling is essentially percutaneous collagen induction therapy. It's a fancy way of saying that placing needles into the skin will trick the skin to create new collagen. During a microneedling session, multiple fine needles puncture the skin to create microchannels, which are microscopic, evenly spaced wounds. In response, the skin goes into repair mode and makes more collagen, often improving skin quality and stimulating hair follicles. Microneedling works by harnessing the body's own wound healing cycle. This includes wounding or microneedling punctures, followed by inflammation, with reparative cells moving in to begin the healing process, and finally proliferation, where collagen and elastin is produced. By tricking the skin to thinking that it needs to repair itself and building up collagen, some people start to see real improvements in their skin. Inflammation post-treatment can help make skin glow, though full results are achieved over time. And use cases include the following: improving fine lines and wrinkles, such as crow's feet; improving new and old scars, including acne scars; improving sun damage; improving elasticity, increasing collagen; and reducing rosacea. For hair follicles, it's thought that microneedling increases blood flow, bringing more growth factors to the hair follicles. It can also activate stem cells in the hair bulge area. This in turn will increase the thickness or the diameter of hair, creating more mature and less villous hair. This can in turn be helpful in treating androgenic alopecia, alopecia areata, especially for smaller spots, and potentially telogen effluvium. Remember that for your hair, microneedling is a stimulant of sorts, similar to minoxidil, for example. It's not going to delay the progressive hair loss, but it might make the hair that you currently have appear a bit thicker. If you're looking to delay progressive hair loss and basically to keep your hair from falling out, you should look into something like finasteride, and we have that available at feelconfident.com. Microneedling can be performed alone, or it can sometimes be combined with other adjuvant treatments. That includes PRP, or platelet-rich plasma, which is used to introduce growth factors and further support healing and growth; minoxidil, to help improve hair regrowth, though keep in mind that combining microneedling with minoxidil can sometimes increase how much it burns when you use them together, because minoxidil usually has some alcohol component in its formulation, and that can burn if you're also needling the skin. Also, microneedling can be combined with radiofrequency energy for additional skin tightening. When all is said and done, there's substantial clinical evidence that microneedling can do the following: improve hair regrowth, improve skin texture and rejuvenation, and improve the appearance of scars. But it's not a one-size-fits-all solution. Clinical efficacy, of course, depends on the specific use case. For example, I'm actually not keen on microneedling of lip lift scars because of the potential to cause atrophy, or essentially tissue loss that can occur in the area of the scar. It could then lead to that area appearing more hollow. Microneedling can also be problematic on the scalp because it can potentially increase scar tissue formation, and sometimes it's not scar that you see on the skin surface, but deeper scar, so that when we're doing something like a hair transplant, we feel the texture of the tissue being different and the elasticity of the tissue not being the same, and that could potentially affect something like a hair transplant result. Many papers and reviews show that microneedling is considered overall safe and effective for treating wrinkles, for some scars, and for combating some hair loss. But it's also widely accepted that more research is needed to classify microneedling as truly therapeutic and to determine how effective it is for a wider variety of skin conditions. I also wanted to discuss the in-office treatment with microneedling compared to the at-home use of microneedling. In the office, there's usually a wide range of needle depths that are used, anywhere from 0.5 millimeters up to potentially 2.5 millimeters. Keep in mind that if you're applying microneedling for androgenic alopecia of the scalp, you need to know that the scalp thins as we age, so the depth of needle penetration should be reduced as we get older. But of course, people aren't always measuring the thickness of their scalps, so sometimes it's hard to predict exactly which length is optimal for each person at every decade of life. And if you go too deep, you can increase the risk of scarring. The endpoint of microneedling is usually seeing signs of erythema or redness, as well as pinpoint bleeding. This usually takes anywhere from 1 to 3 passes, depending of course on the area as well as the depth of penetration. Some argue that going deeper is better, and there is some data to support that, but keep in mind that you're also potentially causing more scarring and damage to the deeper structures. So while you might be delivering a more efficacious treatment, you are also increasing your risk of real side effects and complications. In terms of frequency, these treatments are usually administered every 1 to 8 weeks, depending on your treatment program. Proper disinfection and pain management are extremely critical for delivering both an effective and a very safe treatment. Here are some of the drawbacks to be aware of when microneedling for hair loss and attempting to regrow your hair: itching, hair shedding and breakage, erythema, and scarring. The greater the depth, the greater the risk. Infection is also possible, but extremely rare if you're seeing a reputable provider and following the proper pre-treatment and after-care protocols. Now, what about at-home microneedling? A lot of people are buying up devices and using it at home, so they're saving money. What's wrong with that, right? Well, the FDA regulates microneedling devices that are considered medical devices, and manual or motorized devices with a needle length over 0.3 millimeters or adjustable lengths are considered Class 2 or Class 3 devices. These devices must go through FDA pre-market approval or clearance, which often requires clinical trials and safety studies. But the devices being sold online usually have needle lengths greater than 0.3 millimeters and are not FDA approved. Unregulated devices means that you might have metal contaminants or unsanitary devices that you would not be wanting to put in your skin. These days, I generally recommend against microneedling at home for these reasons. Scarring is a high risk from these at-home devices because it might be difficult to control the exact depth of penetration, and often people don't know how many passes they need on their face or on their scalp. And hair breakage risk is high due to the common roller format of microneedling that's done at home. Also, skin pigmentation changes can occur, and these could be permanent. And disinfection that we talked about previously could be a real challenge to do at home. So the verdict here is that microneedling should ideally be performed in office only, with the right device for the right person, performed by the right provider. Here are some things to consider if you're pursuing microneedling for your skin and or your hair. Consider postponing if you have an important event coming up, such as a wedding or a job interview. 1 week before treatment, discontinue retinoids or any other topical acids. Plan for about an hour to an hour and a half of treatment time. Topical numbing alone can sometimes take anywhere from 15 to 30 minutes. Prepare for some discomfort. People often feel the microneedling more on areas like their temples or their forehead. Aftercare is very important, making sure that you use only the most gentle products for your skin and your hair. And on that note, make sure to check out feelconfident.com for high quality skincare and hair care products that won't break the bank. Consider also using mineral sunscreens to protect your skin after these treatments, and avoid acids and retinoids for about 3 to 5 days post-treatment. Also avoid exercise and hot showers soon after the treatments. Have you ever done microneedling for your skin or your hair? What's your experience been like? And lastly, if you have been microneedling at home, will anything that I said here dissuade you, or will you continue to microneedle at home? Let me know in the comments below.